What are the risks of cosmetic upper eyelid surgery?
Cosmetic upper eyelid surgery can be a highly effective way to improve the appearance of hooded eyes and drooping eyelids. Specialized procedures such as Asian eyelid surgery can be done so you appear as if you were born with a natural eyelid crease that reveals the beautiful shape of your eyes. Successfully performed cosmetic upper eyelid surgery doesn't draw attention because it looks natural and fits with the individual's facial characteristics. What we do notice almost immediately are the eyes of people who had eyelid surgery and don't look like themselves. Typically, they look tired, tight, and even surprised. Eye contact is the foundation of social interaction, so having eyes that don't look natural can have a significant impact on so many aspects of your life. Cosmetic upper eyelid surgery is a complex art in order to achieve attractive and natural-looking eyes. It's also a science requiring scientific precision to the point that the difference between great results and complications can be measured in millimeters. I'll discuss the risks involved in cosmetic upper eyelid surgery and what I do to plan and perform procedures with a high rate of successful outcomes. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I routinely perform cosmetic eyelid procedures every day in my practice, such as lower eyelid surgery for under-eye bags, upper eyelid blepharoplasty for hooded eyelids, double eyelid surgery to create an eyelid crease, as well as specialized oculoplastic procedures such as eyelid ptosis surgery. I also specialize in revision eyelid surgery to help people who've had complications from surgery originally performed by other doctors. A significant risk and concern for patients I see in consultation for upper eyelid blepharoplasty is excessive skin removal such that the person has difficulty with eye closure. One of the most common indications for upper eyelid surgery is called dermatochalasis. Dermatochalasis is a condition where the upper eyelid skin stretches and thins, resulting in redundant folds over the eyes and creating a hooded appearance. I find that the shape created by this hooding essentially defines the shape of the eyes and makes the eyes look like you're tired or angry. To treat the hooded appearance, eyelid skin needs to be removed. A first impression to how to address excess skin may be to just pinch the skin and remove what's being pinched. It's actually not so straightforward. The upper eyelid needs to move with ease during blinking and in order to properly distribute the tear film over the eyes. This means you need to leave behind enough skin to allow for this action to take place. In addition, the skin below the brow may have descended because of the eyebrows being in a lower position, what is referred to as eyebrow ptosis. During the skin pinching process, there may be recruitment of skin below the eyebrow, which can cause downward displacement of the eyebrow and keep the eyes looking like they're still hooded. Further, the extent of skin removal can actually drag the eyebrow closer to the eyelid, which is not a good look. The skin elasticity is critical when determining the amount of skin that's needed to be removed for eyelid surgery. If the skin has limited stretch, less skin needs to be removed. If the skin is very elastic, more skin needs to be removed. When too much skin is removed, the eyelid function can be compromised. The patients with skin shortage after upper eyelid blepharoplasty will often complain of their eye or eyes looking too open and feeling discomfort with blinking. They also report that their eyes don't close even when they're sleeping. It's common for these patients to need dry eye therapies, such as the frequent application of artificial tears and lubricating gel or ointment to be used at night. For patients who come to me in this situation, I typically have to perform skin graft surgery in order to restore the skin needed for proper eye function. So what do I do to minimize the risk of skin shortage after surgery? Well, I factor in skin elasticity, eyebrow position, and eye health when I draw my design. I spend a lot of time taking measurements. The art is also in the placement of the eyelid crease as well as where the skin removal should begin and end relative to the inner and outer corners of the eyes. I also provide some estimation as to what the patient's upper eyelids will look like by using an instrument or a Q-tip to displace the skin inward to reveal a more defined eyelid crease. Cosmetic upper eyelid surgery is not just about redundant skin, but also about fat located in two distinct areas. The first is called orbital fat. There are two fat compartments and the lacrimal gland within the space between the bone and the muscle that lifts the eyelid called the levator muscle. The volume and position of the prolapse fat as well as the lacrimal gland have significant effects on the appearance of the upper eyelid. This is why upper eyelid blepharoplasty is not just a skin removal procedure. As the surgeon, you have to be able to anticipate the appearance that will result when you are sculpting the prolapse fat in the upper eyelid. If too much fat is removed during surgery, it can cause the upper eyelids to look hollow and even droopy. The second area, which is relevant to the appearance of the upper eyelids, is fat and soft tissue located below the outer aspects of the eyebrow called the subbrow fat. I focus on this area particularly if the outer part of the upper eyelids look very heavily hooded. The result is a more open space on the outer aspect of the upper eyelid, revealing the true shape of the eyes. I often see patients who had surgery elsewhere and are concerned about having had too much fat removed. They're looking for a solution to restore some fullness over their eyes. There are several surgical options which I have performed throughout my career, including fat grafting and dermis fat graft surgery. The challenge is that in this area, particularly after surgery, there can be a limited blood supply. Limited blood supply could compromise the viability of a tissue graft. I have found that the placement of hyaluronic acid filler to restore fullness has been highly reliable in achieving improvement, which can be appreciated immediately. The technique I use allows me to place volume with great precision, and my patients don't have to have a recovery time as they would after surgery. Another common issue I see is not addressing the presence of eyelid ptosis. Eyelid ptosis occurs when the margin of the eyelid is lower than it should be. The cause of eyelid ptosis is generally related to the muscle which lifts the eyelid, called the levator muscle, like the word elevator without the letter E in the beginning. It's been my observation that general plastic surgeons choose not to address eyelid ptosis and essentially hope that removal of skin and fat will be enough for a good result. As a cosmetic oculofacial plastic surgeon, I couldn't disagree more with this head-in-the-sand approach. When the upper eyelid is too low, you look tired or sleepy. So when ptosis is not recognized and addressed, the eyelids will still look droopy after the surgery is performed. A basic fact and point of differentiation between the residency training of general plastic surgeons in comparison to fellowship training of oculofacial plastic surgeons is as follows. A general plastic surgeon during a residency in a typical hospital will have limited exposure to eyelid surgery in comparison to their exposure to breast, hand, and other body reconstructive procedures. Since residency programs receive support from Medicare, it's unlikely for a general plastic surgeon to have significant training in cosmetic eyelid surgery or specialty training in cosmetic oculoplastic surgery. Otherwise, the taxpayer would be paying for elective cosmetic procedures, which is not supposed to happen. Cosmetic surgery and oculoplastic surgery training are examples of fellowship training. These are training programs for doctors after completing a residency. As an oculofacial plastic surgeon, I first trained in ophthalmology or eye surgery. I then received specialized training through fellowship in order to learn specialized procedures, such as ptosis surgery. If a patient has ptosis and is going to have an upper eyelid blepharoplasty, I can operate on the levator muscle as well as the muscle behind the upper eyelid called Mueller's muscle. These are not procedures typically performed by general plastic surgeons. Brighter looking eyes after ptosis surgery with blepharoplasty can be very gratifying for the patient. There are always risks to any surgery, but risks can be reduced through the experience and expertise of the operating surgeon. Eyelid surgery is one of the procedures you don't want to choose based on cost or by assuming that all eyelid surgery procedures are the same. As business and marketing in elective healthcare services become increasingly commoditized, for example, think about ads for discounted liposuction. You, as the patient, have to be your own advocate. Eyelid surgery is unique in that the results of a cosmetic procedure not only affects your appearance, but also affects your vision. I hope you found this information helpful. Thank you for your question.